I'd like to discuss with you the most effective and least expensive mouthwash that you can use. I was introduced to this in the early 1990s in a conference in Mexico by Dr. Jorgen Slotz, who has published extensively on this procedure. He is not only a periodontist, but also a microbiologist, bacteriologist at the University of Southern California. And what he has advocated is taking a very weak solution, 0.05% of sodium hypochlorite as an oral rinse. Where do you find the sodium hypochlorite? This is household bleach, which can be found at any grocery store. And you want to go and use only 1 teaspoon of this per quart of water. Be sure and get the plain and unscented sodium hypochlorite, as we say here. You need to use a measuring device, for most people tend to make this solution way too strong. And if made properly, it does not taste even as strong as swimming pool water. It has a clean smell to it with a very mild taste. So use a measuring spoon, such as we show here, so that you accurately measure it rather than just guessing at how much to go in. On the bottom we see a tablespoon, and certainly this is not what you want to do, but use a teaspoon. And I'd like to emphasize that more is not better. Here we see the two things that you need, the quart jar and the teaspoon, which you will use to measure before adding water to this. Before using this solution, view the video on my website, www.pdmillerswebtextbook.com, and there will be a video that will show the importance of cleaning your tongue and as it relates to malodor. The tongue scraper that I like was developed by Dr. Robert Rippich, and this instrument not only gets well back in the posterior area, but also does not gag you. As I said earlier, you can view a video on exactly how to use this on my web textbook. How do you use a solution? First of all, use about 1 ounce and swish it between your teeth after brushing and flossing. Second, gargle to kill the bacteria and viral pathogens that remain after brushing and flossing. Gargle kills the bacteria pathogens that are associated with postnasal drip in the posterior part of the mouth, as well as cleaning the tongue. Before rinsing, use the tongue sweeper that I previously talked about to scrape and clean the slime off the posterior part of the tongue. Finally, rinse vigorously with plain water before spitting out the rinse water. What if excessive probing depths result after periodontal therapy? Again, placing this solution in a water irrigator to force the solution deeper within the subgingival remaining areas will certainly help control the progression of periodontitis. In this case, you may want to use a solution of 4 teaspoons to a gallon of water, 4 quarts. This may prove more practical in avoiding frequent mixing of the solution. A certain disclaimer on this we need to be aware of. This information that I am providing for you is for information only and you should use it at your own risk. Second, the solution is highly effective and kills bacteria, virus, spores, fungus on contact, and is used in hospital situations where there is a blood spill. Under no circumstances should it be swallowed, as this could possibly result in kidney damage. Children should not use the solution because they may inadvertently swallow some of the solution. And finally, pregnant women should not use this, for the impact on a developing fetus is certainly not known.